IMG3D, a comprehensive ocular anatomy and pathophysiology 3D atlas application to enhance ophthalmic pedagogy. No financial disclosure. Currently, most of the teaching apps use 2D animated or 3D animated ophthalmic images. The aim of our novel IMG3D app is to build a real-time 3D interface with high-resolution, true-color confocal images for both concept teaching and clinical counseling. It has been made available in Google Play Store for Android users free of cost and is under alpha testing for iPhone users. It is also available in a Windows version as well. Materials and methods. Real confocal unanimated fundus images of our own patients were used to construct the 3D eye models. Wide field 110 degree true color confocal fundus images along with autofluorescence and infrared images were used in constructing the posterior segment. For constructing the anterior segment, complex structures such as the angles of the anterior chamber was constructed with 3D photoreal visuals from real gonioscopic findings as seen on the bottom right of this video. Construction of the 3D eye models were done in the Unreal Engine software. Multiple cameras shown as the blue objects were used inside the Unreal Engine software to view various parts of the eye from multiple angles. The various parts of the anatomical and pathological eyes were coded in Unreal Engine software for customized sectional viewing and zoom of choice of the app user in 360-degree angles in a very dynamic way. This is the main menu of the IMG3D app. For viewing the normal anatomy, click on the Anatomy button. For viewing the pathology, click on the Pathology button. For viewing educative clinical videos, click on the Videos button to access them in 3D with real-time confocal images. Let us see a live demonstration of the app. Once the IMG3D app is open, let us start by clicking on the Anatomy button. Once the Anatomy button is clicked, an eye in 3D with normal real-time structures are shown. Now for example, if the anterior segment button is clicked, the anterior chamber structures are shown with dynamic transitions. Now by clicking the Angle button, gonioscopic view of the angle is seen with the parts marked for every structure. Now by clicking the Trabeculum Meshwork button, further electron microscopic view of the angle can be accessed. Similarly, by clicking the posterior segment button, the fundus structures can be viewed dynamically. Now, by clicking on the fovea button, users can get the magnified view of the fovea. Similarly, by clicking on the optic disc button, users can get the magnified view of the optic disc in great detail. Practical advantage of this app is the customization button given to remove the vitreous and the lens for better visualization of the fundus. Another main highlight feature of this app is the visualization of the pathological fundi, which is performed with multimodal imaging. For example, a flecked retina can be seen in color, autofluorescence and infrared by clicking their respective buttons. Multiple pathologies can be chosen from the bottom left toolbox as shown in this video. This is a case of normal tension glaucoma with splinter hemorrhage. In this video, the infrared image is accessed in a zoomed posterior segment view. Simultaneously, comparison with color image superimposition can be done and studied. This is a scenario where neovascularization elsewhere was chosen from the pathology toolbox to visualize it in the view of choice and fundus filter of choice of the user. That's the USP of this app, which is to give the freedom of choice selection exclusively to the user as seen in this retinitis pigmentosa case, where different multimodal images are selected. Another feature of this app is the video section for educative teaching. For example, if the user chooses the central retinal vein occlusion button, A simple educative video with confocal images are constructed to give an overview of the disease. In the normal fundus, a block diagram animation module is shown for the arterial and venous flow in the retinal artery and vein respectively, followed by the formation of thrombus in the lumen of the central retinal vein, which leads to the blockage of the central retinal vein, which in turn causes the central retinal vein occlusion with tomato splash appearance of fundus with hemorrhages in all four quadrants. The anterior segment evaluation demonstrates the relative afferent pupillary defect. This video further emphasizes what happens if not treated for 90 to 100 days with development of neovascularization in the posterior segment followed by neovascularization of iris resulting in neovascular glaucoma. Discussion. This app serves as a pedagogical transformation tool for e-ophthalmology learning. It is also constructed in a patient-friendly format to establish e-counseling stations. Procedures ranging from a simple YAG-PI or anti-VEGF injection to a complex trabeculectomy or retina surgery can be counseled with this app. To conclude, according to our knowledge, there is no application to date which incorporates real-time, high-resolution, true-color confocal, multimodal fundus images and photoreal visuals for interactive 3D learning. IMG3D simplifies ophthalmic concept learning for an immersive 3D pedagogy and also aids in e-patient counseling. It is available free of cost for download from Google Play Store, or you can scan the QR code above with Android phone to use it. Windows version of the same app can be accessed from the website meh.org.in. It is also provided free of cost for the benefit of the PC and laptop users who are comfortable with a bigger display screen. Not only normal 3D models, but pathology models such as flecked retina, neovascularization elsewhere, retinitis pigmentosa, glaucomatous nerve fiber layer defects, myelinated nerve fiber, splinter hemorrhages, and more are provided as bi-weekly updates in the IMG3D teaching app with multimodal images for the users to learn and teach. Thank you.